Hello viewers, welcome to Dr. Malik, Dr. Malik Talk Show, your everyday doctor, your answers to your medical concerns. And today we are going to talk about ovulation. Ovulation. What is ovulation? How is ovulation important? And specifically the signs and symptoms of ovulation, the signs that show that you are in ovulation. Just to give you a highlight, ovulation is the process of releasing an ovum or an egg from the woman's ovaries to the ampulla where it's supposed to be fertilized from. So it is important to know this day, because when you know this day, you will know that day exactly to have productive sex, to have sex and become pregnant. Otherwise, there are a lot of women who have no reproductive issues. They don't have any reproductive problem. The hormones are okay. The functionality, they don't have any masses, no uterine masses, no fibroids, no nothing. But the only problem that they have is either irregular periods or inability to calculate the rightful ovulation day. So today, we are going to look at the signs and symptoms that shows that you are probably in ovulation. It is important for you to know. It is very important for you to know in order to save time and have a child and conceive. This is also very important, especially for people who are in long distance relationships. So it helps you plan prior and know when to travel, when to meet your boyfriend or husband, and when to have productive sex. Why? Because ovulation happens for only 24 hours. Once it exceeds 24 hours, the egg or the ovum that has been released becomes void, becomes nullified. It's no longer able to be fertilized to make a baby. So it is important for you to know this day. These 24 hours will be very, very crucial for you. They will be very crucial for you. So when we are to look at the ovulation and the signs and symptoms, since we have known that ovulation is the day that helps someone, or that the day that someone will be able to get pregnant within the cycle. So if you know these signs and symptoms, it guides you and helps you know about the factors that we have talked about. Some of the signs and symptoms that we have is one, breast tenderness. When someone is in ovulation, the breasts are tender. This is actually not a sign, but it's a symptom. It's a symptom. It means it's the owner who will feel the symptom. When the owner touches the breasts will seem to feel some kind of pain. Not really so much pain, but they will feel some kind of pain after stimulation or after touching, after being touched. Still looking on the breasts, these breasts are enlarged. These breasts are enlarged. It's not to say that they will be so much enlarged that they will change. Still, this will be more of like a symptom to the owner, the female, the woman. You will be able to see and note some slight change that the breasts have enlarged because of the hormones that are involved in the process of ovulation, the luteinizing hormone, the estrogen, and all those hormones. Your breast gets enlarged a little bit, and it can be noticed by you, who is the owner. So the breast becomes tender and enlarged and somehow change in the size. Then the other symptom is heightened senses. Heightened senses. These senses are usually either hearing or smelling or taste. Hearing or smelling or taste. They will have a very functional olfactory system that they can smell even the smallest thing. They can smell even something that is kind of far away from you, the normal person, or us, the men who are not in the ovulation at that time, or any woman who is not in ovulation at that time, will not be able to smell. Or they will be able to taste. They will have a high sense of taste in the mouth. So